I am here today with epidemiologist Bonny Specker, who is going to give us a COVID-19 situation update about South Dakota COVID-19 mortality data, a little bit of information about a second booster, some organizations that are monitoring COVID levels in wastewater to see what the rates are. She's also going to talk about long COVID and mental health among youth, and then also talk about what's been happening locally, regionally, in the nation and in the world when it comes to COVID-19. Bonny, it looks like you have a lot of awesome stuff for us today.
Yeah, it's been a month and the numbers have actually been pretty good this past month, but a lot's been happening even though our numbers are down, and I guess that's okay. But I thought I'd just catch people up with some of the things that have happened, at least in the last couple weeks. South Dakota every month updates its mortality data, and these are the numbers by month. And I just want to go over real quick what these different things are. This white line is the average between 1960 and 2019. And these are death rates per 100,000 population. And the reason they express it that way is that the population in South Dakota has changed over time. So you need to adjust for that. But this is the average death rate, and these dashed lines are the highest and the lowest rates observed over that 60-year period. I've presented this before, but this is the 2020 data, and these asterisks are the highest monthly death rate ever for a given month. So in 2020, we saw the highest ever death rate in October, November, and December. And you can see that it's quite a bit higher than the average death rate over that period. The yellow line is the data for 2021. And here, I'm sorry, it's 2021, it's September, that's the highest it's ever been. In 2020, it was just October, November, and December. They just came out with the 2022 data for January. Over here, this little pink dot is the highest monthly death rate ever for the month of January. So we're still experiencing a high number of deaths. This is really Omicron, and as well as this is the beginning, that peak that happened last fall. As far as the booster, the end of March, the FDA authorized a second Pfizer or Moderna booster for people over 50 and individuals who are immunocompromised. And this is a really good article down here that I recommend people go to. It's a NPR article. And this booster can be given at least 4 months after the first booster. And this article talks about things that you might want to consider when deciding whether or not you're going to get that booster. Consider that risk increases with age. So the older you are, even in that 50 and up age group, the more serious the illness can be. So you probably want to get that booster. Also, do you have underlying conditions that put you at higher risk? The immunocompromised people obviously need a little extra boost. And that timing from the last dose or infection is important. If you're only 4 or 5 months out, that's not as bad as being like 7 or 8 months out. So the further you are from your last booster, the more important it is to get another one. So I've actually considered all these things and the fact that I'll be traveling in the next month. So have an appointment for my second booster this afternoon. Wastewater. Here we have a map. The CDC is now tracking wastewater. This is a really great idea because we know everyone has all these home kits. So when we're looking at number of cases, we can't really, it's so underreported because there's just not, home kits results aren't reported anywhere. So we don't really know how many cases are in a neighborhood. A lot of people are using hospitalization data, but that's several weeks after the fact. So you could be experiencing a very large increase. in the number of cases, and you don't know it until several weeks later. So you really need some sort of surveillance system early on. Hospitalization is too late. So the CDC has been working with a lot of different organizations, and they've come up with this way of tracking the virus in wastewater, like sewage and the sludge. And you can see from this map, the red colors, the brighter, this area down here, the colors there, yellow, orange, and red, are showing where there's been an increase in the amount of virus in wastewater. So you can see Maine looks like they're having a possible outbreak, Chicago area, maybe this area around Cincinnati, definitely over here in Utah and Colorado. We have one orange here. So it's just another way of trying to get at what's going on. So it's something to keep track of. This is the website. They update this each month, and this has changed over a 2-week period.
And we actually did a video on this a while back.
Right, with Victor Huber down
Yes.
at USD.
Yes.
And he is tracking it, and they're seeing slight increases, but nothing really yet to be concerned about. So,
Well,
and
good to know that there's someone in our neck of the woods that is on this.
right. And he's on that committee that, for the city. We had a committee during the last 2 years made up of virologists, not just myself, but other epidemiologists who have met weekly, and we continue to meet weekly. And we actually talk to Victor about what he's seeing. And so we can try to convey that when they feel pretty confident that they're seeing an increase, we can let the city know. So we are sort of monitoring it. Okay, as far as long COVID, there's a lot in the news just the last couple of days. Tuesday of this week, President Biden announced that the Department of Health and Human Services is going to coordinate a massive plan to address long COVID. Right now, it's estimated that anywhere between 7.7 and 23 million people in the US are affected by this. And it has a whole variety of symptoms. I'm sure people have heard about it since either they've had COVID or other people they know have it and are experiencing some of these symptoms. But part of it is a headache or that brain fog that people talk about. Some people have a persistent cough or are short of breath. There's this bruising and rashing, loss of taste or smell. Pounding heart and heart failure is happening. You're seeing that more often in this long COVID, as well as kidney injury and failure. So it's a whole kind of very seemingly unconnected set of organs that are being affected. Now, the UK just released a report, and the link to that report is down here for people who want to review it in greater detail. But it summarizes all the studies that have been done before the middle of January of 2021 that looked at whether or not the vaccine can prevent long COVID. And they identified 15 studies, and 7 of those studies looked at the effect of the vaccine before the infection. So that would have been in people that had those breakthrough cases, and whether or not the vaccine, those people that got the vaccine had fewer symptoms or fewer occurrences of long COVID. 7 of the studies looked at vaccination in people with long COVID. So you end up with long COVID, you go into the doctor and, I've been sick with COVID a month ago and I'm still having symptoms. And what does, can the vaccine be used as an actual treatment for that situation? And then there was one study that examined both of those scenarios. So one is, can you prevent the long COVID with vaccine? And the other one is, can you use the vaccine as a treatment for long COVID? If you look at it for whether or not you can prevent long COVID through the vaccine, They did find 6 of 8 of the studies found that the vaccinated cases were less likely to develop symptoms either in the short term, midterm, or long term. And fully vaccinated cases, the people that received the whole series of vaccines, were less likely to have various symptoms of long COVID, both in the midterm and the long term. And I know I'm going through the slides kind of fast, but you will post them so people can take their time and look over them. As far as the effectiveness of the vaccine and treatment of long COVID, this is where it gets kind of, I'm not so convinced by what they're seeing. But in general, patients reported improved symptoms after the vaccine. 3 of 4 studies found that. But all of the studies reported worsening of symptoms in some of the patients. There just were more that had improvement. You see that in studies. Some people respond, other people don't. But there's some other things that make me a little hesitant about this, how effective this is. But there were 3 studies that took people who were unvaccinated at the time that they developed COVID, and then they compared the symptoms in those that were subsequently vaccinated once they got COVID versus those who remained unvaccinated the whole time. And the people with long COVID who were vaccinated were less likely to report symptoms than those who remained unvaccinated. So the vaccine appeared to help, in some of the cases. And an interesting thing is the sooner they received the vaccine, the less likely they were. So if you get COVID, you haven't been vaccinated, and then you get COVID and you get vaccinated, the sooner you get vaccinated, the more likely you are not to have these symptoms of long COVID. But a high percent of the studies and the people in the studies reported unchanged symptoms. So 70% of the people didn't have any effect at all, but that other 30% tended to be a positive effect, that it helped. So it's not like a fail-safe treatment for long COVID, but it is something that it looks like they're trying. And I do know that Avera Health System in Sioux Falls does have an ongoing study that they just started looking at treatments for long COVID. And if I find more information out about that, I can let you know, and maybe it's something that you could post on the website for people that have that. Now, I also want to just briefly mention the mental health of youth. I know that it's a topic that's out there right now, and a lot of people seem to think that this is a result of the pandemic. And there are really no data yet showing that it's the pandemic. And I just wanted to explain that a little bit more. This past week, the CDC published the results of a survey that was done in 2021. And they did find that a lot of youth, high school students in particular, 55% of them reported some sort of emotional abuse during the pandemic. 11% experienced physical abuse. Now, prior CDC data has shown that mental health was becoming an issue among our youth before the pandemic ever started. And I just want to show you some of that data for South Dakota. This is the South Dakota Youth Risk Behavioral Survey. It's done in South Dakota every 2 years. And they ask specific questions, the questions they ask kind of alternate. I should say it's done in the United States every 2 years, but here in 2017, it was not done in South Dakota. If you look at just, these are the suicide data, and again, the report for the YRBS is down here, the link. It covers a lot of things, substance use, not just suicide. But I pulled out the suicide data because we are ranked one of the worst in the country for adolescent suicides. The percentage of students who seriously considered attempting suicide in the past 12 months has increased from 17% in 2009 up to 23% in 2019. This is prior to the pandemic. And if you look at the US rate, it's only 18.5%. So we're much higher than what you see nationally. If you look at the percent of students who plan on how, like they make a plan about how to attempt suicide, 19% of those in 2019 in South Dakota compared to 12. And in the US it's 15.7%. These arrows here are implying that this change between 2009 and 2019 is statistically significant. And here, percent of students who actually attempted suicide, that increased back in 2009, it was 6.7%, and in 2019, it was 12.3%. So almost a doubling of that. And here, the 2019 number for the US is 8.9%. Now, I did contact the Department of Health because there's a 2021 YRBS. That data set is being finalized by the CDC, and it should be available and out, I'm thinking sometime this summer, based on what they were saying. So it'll be interesting to see what kind of changes occurred between 2019 and 2021, from the pandemic. But I think it's important to realize that a lot of the mental health issues that we're seeing in the youth were occurring prior to the pandemic. Now, the pandemic may exaggerate those problems, but if you're looking for a cause, it's something other than the pandemic, was starting to increase these behaviors.
I just did want to say about a year ago, a little over a year ago, actually, we did do a survey to residents. And one of those main concerns with the pandemic was mental health. And I just want to let residents know, and I'll put the link in the description of this video. There are definitely local resources that if somebody is experiencing mental health concerns, the Helpline Center has put together a mental health guide that provides resources and local resources that people can find to get that help that they need. And if somebody is experiencing that, I just want to let people know, that is a serious concern, and reach out, ask for help. There are resources available. And
is that 211
yes.
number?
Yeah, you can call 211 and they can connect you with resources through the helpline. And then the helpline actually has put together a mental health resource guide that is specific to our area. So there are definitely reach out, definitely use those resources. Talk to someone. It's been a hard couple of years and people are struggling, and we want to make sure that no one is left behind and doesn't get the help that they need.
Right.
Yeah.
Okay, so the summary for this week. Here we have the Brookings data. You can see this past month we've had very few cases. And this is probably true. Again, we aren't sure how many cases are out there, but it does look like the numbers have dropped really nicely. We only had 3 cases this past week, 2 the week before. You can see that they tend to be in the younger individuals. This line we discussed last week, this is how it's determined whether or not what kind of community spread we're in based on the new CDC guidelines. These are the hospitalization data for Brookings County. The last time we had a hospitalization was early in March. So it's been over a month since anyone's been hospitalized. Again, very good data. This gives me faith in the case numbers. The case numbers might be a little bit higher, but we're not seeing the hospitalization. So that's great. We did have a death reported this past week, which I'm not sure when that death occurred. It could have been a while ago, and it's just now appearing on the dashboard. So you have to realize these things appear on the dashboard can be quite a ways from when it actually occurred. But we've had a total of 52 deaths since the beginning of the pandemic. If you look at the cases in South Dakota, it's also very low. Down here, we had 137 last week and 154 the week before. And it's kind of, through the past year, it's been sort of equally spread among the different age groups. Now we're seeing it in those young people, probably because that contains a fair number of unvaccinated people. But we're also starting to see quite a large chunk in the older people, and that could be that waning of the vaccine and, showing the need for boosters. Hospitalization data, it has also dropped. And we had the largest number of hospitalizations this past week in that 40 to 59 year age group. Hospitalizations are occurring across all ages. So here's the hospitalization data when we look at just who's hospitalized on the different days and how many of the staffed beds are occupied. This is one of the things that goes into determining the level of spread. And you can see we've had a big drop in the number of people that are currently hospitalized. Right now, we only have 41. 3 of them are in the ICU. That's this yellow line. So we're doing much better than we were, 2 months ago. If you look at the deaths, we have a little blip here this week. We had 10 deaths reported on the dashboard. These deaths are likely to have occurred over a wide range of dates prior to this. So there are little like ups and downs in the way these are reported on the dashboard, just because of the time it takes to get through vital records and the actual coding of the death certificates. So I don't think this is a true increase in the number of deaths. It's just, it is heading down. If you look at the United States, again, it's coming down as far as the number of newly diagnosed cases. And we're pretty low. We're low almost to where we were last summer. But, deaths are still up there. And this is kind of odd. And maybe this is a reflection of the underreporting of cases. We've dropped a lot in deaths, but 4,000 deaths a week is still way too many. And hopefully this will continue to drop, although there is some concern about that BA2. And maybe next month we can talk about that. It is increasing in Europe right now, and whether or not we're going to see an increase isn't quite sure. No one's quite sure about that. And here, you see that drop, but we're not getting the drops in the deaths. So either this is the people that have been sick with COVID for a long time, back when we had the Omicron peak, but we're not getting sort of the decline into this range that we would expect. Or those are actually the cases globally. So this is probably up because of that, BA2 in Europe. And here we've got the decline in deaths, but it's still quite high, about 26,000 deaths a week this past week worldwide. So it's heading in the right direction, but it would be really nice to get those deaths further down. And I think this is going to become my mantra. Be kind to each other and yourself. And we're getting through this one way or another. That's it.
Well, thank you, Bonnie. I want to make sure I'm correct on this. The South Dakota Department of Health has moved to reporting weekly now, correct, instead of daily numbers. So if individuals are following that South Dakota Department of Health COVID dashboard, just know that it is only updated every week on Wednesdays. So if you go every day, it's going to be the same number until Wednesdays. So we also put out the slides on the city website on Wednesdays, Thursdays, or Fridays. It's always the end of the week, but those are the most recent numbers because you take those on Wednesday and add them into the slides. So
that's right.
Yes.
The other thing, they will, if things start picking up again, they'll revert back to daily updates. But because the numbers are so low, they just didn't feel that they needed to update it every day. So, but it may change in the future.
Yeah. Well, I for one am happy that the numbers are going down. I'm sure everyone of the residents of Brookings and surrounding area are also happy that the numbers are going in the right direction as well. So until next time, when we do another update, thank you so much. And hopefully eventually we'll get to the point where we won't have to
That would be nice.
do these anymore. So thank you so much, Bonnie.